Welcome, everyone. Thank you for being here today with me as we talk about decoding heart disease. So just a few housekeeping items. If you have a question, please go ahead and put it in the Q&A. And I do welcome questions as we go along. So feel free to put any question in, and I can pause and answer any questions. But if you would silence your cell phones so we're not distracted by it during the talk, I would truly appreciate it. I just want to, I know there's one person here, Galaxy, I don't know your real name, but welcome. And I know you said you can see and hear, and we did a test with my staff, so I think we should be good to go. So the reason I chose to do decoding heart disease today is because it's one of the leading causes of death in men and women. And every 37 seconds, one person dies from heart disease. And 1 out of 4 deaths in America are from heart disease. So the numbers are staggering. And not just that, but I've been working in the ER for over 20 years, days, nights, evenings, holidays, weekends. And I have seen a lot of things. And one of the most frustrating things is when a young or even an old person who's apparently healthy, has no medical problems, no risk factors for heart disease, no diabetes, blood pressure, nothing like that, and they come in with heart attack and maybe die in the ER. And then you're left with this question from the family, like, what happened? How did my loved one die from heart disease? Because they were healthy. So those are the frustrating scenarios, which I'm happy to say now that I actually know what happened. And I have people in my practice who I help prevent getting into that scenario. So that's why I chose to do this talk today. I want to share a little bit with you all about who I am and what I've done and how I ended up in this alternative field. So if you would journey with me, I'm 7 years old. I am sitting at my family dinner table in Pakistan, and we are having chicken for dinner. The food of the rich. And my 3 older brothers get served first, and the white meat, the better part of the chicken, as much as they want. And I get served last because I'm the youngest and a girl. And so I get whatever is left over. And that night, as I'm in my bed, trying to fall asleep, crying, I don't understand why the God who created me would make me inferior just because I'm born a girl. But you see, this was when things were getting more stabilized. When I was 5 years old, Pakistan was at war with Bangladesh. And I remember, I'd be out playing in the yard on the swing set. And all of a sudden, the air raid sirens would go off, woo, woo, woo. And I remember dropping everything, running home, filled with terror, because we were getting bombed. And the family, we would all sit there huddled together in the dark because we don't want the lights on, otherwise we might become a target. And we could hear bombs falling around us and people getting hurt, people dying. And at that point, at age 5, I decided that I wanted to be a doctor when I was older, so I could help these people because I knew this was hurting my friends. So fast forward 30 plus years, I am in America. I am working in the ER. I am living the dream. I am helping people and getting paid to help people. And side note, I'm also now an equal as a woman, equal knowledge, equal pay, which I realized at that point it didn't matter that much, but I wouldn't be honest if I didn't share that part with you. So the only problem is that I am sick. I have joint pains all the time. I have deep brain fog and I can't think clearly. I keep forgetting things. And I am so tired that everything becomes a chore. And I was living on my espresso Advil formula. You take espresso in the morning to wake up and Advil to get through the day. And many a times driving to work, I would go over this bridge in Connecticut where I would have this thought, what if my car just went over? So that was a very difficult season in my life where I had thoughts about hurting myself because anything would be better than living in this pain and misery that I was in. And one day, I got to work in the ER, and a friend of mine showed me this brochure about a conference, a 5-day conference from the Institute of Functional Medicine. And when I read a little bit about it, it seemed like they reversed the script on medicine. So instead of treating the symptom, which traditional medicine does, they talk about treating the root cause. And so I immediately decided I was going to go there, and I went there, and the first lecture I attended, I was like, wow, this is mind-blowing. What's happening? Why have I not heard anything about it before? So at the end of the lecture, I walk up and go and talk to the professor, and I ask her, would you take me on as your patient? Because I knew that I needed a physician. And she did. And we started right away. We got blood work and all the testing, and everything was messed up. I was like, okay, this makes total sense why I felt the way I did, because everything is wrong. And so we started treating me. She started treating me, and I did everything. I changed my diet. I started taking supplements, nutrients. I did sauna therapy. I did IV therapy. And slowly and surely, I started to feel better. And at the same time, I signed up to continue education with the Institute of Functional Medicine because I was like, if this is helping me so much, it could help my patients, because over the years that I'd been treating patients with traditional medicine, my patients were not getting better. They were actually getting worse. And I wanted to bring to my patients this healing, which had helped me so much, get my life back. So that is what I bring to you today, because I have seen the power of functional medicine, and I've studied it in depth for several years now and treated hundreds of patients with it. And I want to bring to you the secrets that functional medicine has to treat things like heart disease. So secret number 1 is we have to find the root cause of the disease. If we don't find the root cause, then we are continuing to treat the symptom on the surface. Got so carried away, I forgot to move my slides. So let me try doing that. See if that works. I think this is it. So we need to find the root cause. And if we don't find the root cause, if we don't treat the problem, we continue to put a Band-Aid on the problem. So if you were to look at this tree, traditional medicine takes the leaves, which are the symptoms. So each specialty in traditional medicine has their own section of the leaves, which they sort of spray with Roundup or medication and try to treat their section of the leaves. Functional medicine actually looks down at the soil and at the roots to get the problem at the core. And at the core of every problem is inflammation. Okay. Now, there are different reasons why people get inflammation, and that is what I do in my practice, is to find the reason of inflammation. And it's really important to find the reason, because if you think of inflammation as, so if there was, let's say, if there were thieves outside your house trying to break in, you would be on high alert, guns out, everybody lined up in the family, ready to fire at the thieves or the enemies trying to break into your house and steal from you. And when that's going on, you are not thinking about eating. You are not thinking about cleaning your bathroom. You are not thinking about napping, okay? What that means is you're not thinking about nourishing the rest of your cells, taking out the toxins, or regenerating. So inflammation is very costly to your body energetically. It has all its resources going into this one high alert form of protecting itself. So we have to, so what traditional medicine does is it just puts a Band-Aid on the inflammation. So what it's almost like, so if you were ready to fight the thief who's trying to come in, it would be like somebody passed out opium or heroin, cocaine, to numb you out. So you would not be on that stressed out high alert mode. It doesn't mean the threat is gone. In fact, now, because you're not alert, the invader can come in and steal from you and do whatever. And that's what traditional medicine does with inflammation. Things like from the mildest things like ibuprofen or aspirin to prednisone to even the heavy duty medicines that we use in autoimmune diseases. It's numbing out the inflammation. It's not looking at what is the threat. So functional medicine, we have to look at the root cause. We have to find out what is that threat. And then when we can find out what is the threat, we can get rid of the threat. We can call the police, hey, take away this person who's trying to break into my house, so I can be then safe. So one of the major threats or things that cause inflammation and where inflammation leads to heart disease is toxins. And toxins could be anything. It could be lead, mercury, arsenic, cadmium, anything that you are breathing, eating. It's in your water, in your soil, it's in the air. If your body can't detoxify it, it's in your body and it lives in your cells. If you had dental fillings, if you had implants of any kind, if you had surgery, if you had metal from hip surgery. So anything foreign in your body lives in there unless the body's able to get rid of the toxin. So while that toxin is there, your body is on high alert trying to fight this invader. And there was actually a study done in the American Heart Journal in 2014 where they did find out that heavy metal toxins are a cause of heart disease. Okay, And so we have to look for it, we have to test for it, and if that is true, we have to treat it. That's what I mean by going to the root cause and finding the root cause and treating it at the root. Once it's treated, once the toxins are out of your system, then you can go on, right? When the police comes and takes away the thief or the invader, then you can relax and you can breathe a sigh of relief. So your body breathes a sigh of relief, and then it can go on to doing other things, producing energy, taking time to regenerate itself. So I want to give you an example of how I had a patient. His name is John. Obviously, it's a made-up name because of HIPAA in medicine. So John is a young guy, 48, 50 something, and he was healthy. You know, no chronic medical problems, no diabetes, hypertension, anything like that. He worked. He had a heavy-duty job. He worked in construction, and he was recently noticing that he was having some chest pains. And he ignored it for a long time, but then finally he did end up going to the ER one day with chest pains. And they did what is right in traditional medicine. They did the blood work, they admitted him, they did the stress test, and everything was normal. So they said, okay, John, you're fine, have a good life. But John's wife is a very intuitive woman, and she did not believe that there's nothing wrong with her husband who now has chest pains. There must be something going on. So she brought him to see me, and having the knowledge and the information that I have from my training, I looked for the toxins, and we found that he was full of toxins, and we went about treating him. And the reason I knew he was full of toxins was also the blood work has clues. Now, this blood work is specific to functional medicine. So I had clues from the blood work, and then I could specifically look towards toxins. And once we were done treating John for these toxins, we could retest those markers, and those were back to normal. So I knew that there was no more inflammation affecting his heart or his blood vessels. Let me take a step back. So what happens is when there is toxins, it creates what's called free radicals. And those free radicals attack the lining of the blood vessels and the heart and cause inflammation right there in the lining of the blood vessels, which then forms a plaque, which as this inflammation and free radicals keep on, then the plaque can break off and form a plaque, which is what is the end result, which is what we call a heart attack or a stroke. So once we treated John, then I could see that his inflammation markers were normal, that there is no more plaque in his blood vessels. So that is one of the biggest secrets, is to look for the root cause in functional medicine. Trying to move things around so I know what you guys are looking at. All right, so the second secret of functional medicine is we have to heal the gut. Okay, why is that so important to heal the gut? Because 80% of the body's immune system lies in the gut. And the gut is a closed system, right? It's a tube and it's open at two ends. But the tube itself is sealed. There is food goes in, gets digested, but food doesn't leak out of the tube. It goes in and out. There's only one-way traffic. Over the lifetime, various things that we do in our life can cause us to have a loss in the integrity of that tube. What do I mean by that? Like stress or repeated antibiotics or a lot of Motrin or Tylenol or even aspirin or steroids or chemotherapy, or those things can poke holes in the lining of the gut. Now, when that happens, things that were supposed to be in the closed system can leak into circulation. And now we have another invader situation, another inflammation situation, because the body has to mount a response. It's not used to seeing these things which were supposed to be in the closed tube into circulation. And so each time, if you have these holes in your gut, each time you eat something that had at one point leaked out and the body had mounted a response to it, it could be something as healthy as salmon or asparagus. Each time you eat that, the body is on high alert again because it's sensitized to that invader. So we have to heal that lining of the gut. The other thing is when there is this leaking happening, it also messes up the balance of the good and bad bacteria in the gut. And we need the bacteria to be in good balance to maintain the immune system in the gut. And again, there are studies out there that show that the imbalance of the gut bacteria causes inflammation in the blood vessels and formation of the plaque and heart disease or strokes, whatever is whichever body part the inflammation is at. So we have to not only heal the lining of the gut, we have to bring back the balance of the gut bacteria to reverse the inflammation going on in the blood vessels and in the heart. And I'll share an example that I had a lady, her name is Jeannie, again, made up. And she was older, she was 78 or something, and she had had diarrhea for many, many years. And the reason she came to me was because, not that the diarrhea had changed, but it was affecting her relationship with her husband because she didn't want to go out anymore because she was afraid she might not find a bathroom in time. And it was causing a problem because her husband wanted to go out and she couldn't join him. And in talking to her, I also realized that she had high blood pressure and high cholesterol, and her doctor had her on, the usual blood pressure medications and statins for cholesterol. And she was noticing that the statins were making her achy, but the doctor wanted her on it because of the cholesterol. And so once I did my testing functional medicine panel and looked at her gut, I realized that, okay, she has what we call leaky gut, which is what I was explaining about earlier. And her bacteria were imbalanced, which was causing the inflammation, which was causing her high cholesterol and her blood pressure. And then we went about fixing her gut, fixing the lining of the gut, fixing the bacterial imbalance. And everything reversed. I was able to take her off her blood pressure medicines, off the statins, which she didn't need those to begin with. And she was able to live a life without medications, but not just that. And she didn't have diarrhea anymore. And within 4 weeks, I got a call from her saying, I need to postpone my appointment because she was going to go to California to see her daughter. So that is the power of functional medicine, completely changing a life, completely actually giving you your life back, your vitality, so people don't have to, not just the symptoms, it's actually the emotional and financial burden also that it puts on people. Like in John's case, his wife and he himself also, there was such a relief that they don't have to sit there and question, like, does he have something bad going on? Did the doctors miss something? Why is he having pain? And similarly, in Jeannie's case, where she got her life back to travel with her husband and see her kids, and the kids don't have to be in the middle of this fight between the parents where one is too nervous to go out and the other is not understanding that. So illness, there is not just, it's not just a matter of symptoms. It has a lot of emotional baggage that it brings with it. And that's why it's so rewarding to be able to heal it, to give people their life back. Any questions thus far? I know I'm just going through a lot of stuff, and it might be, if it's hard to keep up, then please let me know. I'm happy to stop and explain anything, go over it again. All right. And in that case, I will keep moving. All right. One of these days I'll figure out the computer. Okay. And the third secret is we have to put back the nutrients that are missing in the body. What do I mean by that? Most plants and animals make their own vitamin C. And vitamin C is a very important nutrient when it comes to fighting inflammation, because when I was talking about free radicals, vitamin C is the thing that goes in and chews them up like Pac-Man. And humans and guinea pigs don't make vitamin C in the body, so it cannot make more vitamin C when it's under stress or under inflammation, and less when it's not. So it needs to be a part of your diet or nutrient supplementation. Similarly, magnesium is a very important part. It's almost a part of 300 enzymatic reactions in the body, from keeping the neurons balanced, relaxed, keeping the muscles relaxed, balanced in contraction and relaxation phases. And there's a whole, 300 is a lot of reactions to be involved in. And when we have what I explained before, the leaky gut, the body cannot absorb the nutrients that it needs. So it's not uncommon for most people to be deficient in one of those or both of those things. So an important part of functional medicine is to replace the missing nutrients. And the way I do that is intravenously, because even if the gut is healthy, only a third of what we take in by mouth is actually absorbed. So when we do intravenous, 100% of it is bioavailable immediately for the body to use. So I use intravenous vitamin C and intravenous magnesium and whatever else I find on the panel that is missing. So this is the third secret. We have to give the body the missing nutrients. And I want to share the story of Maddie. And Maddie is 50-something years old, and she's actually a commercial pilot. And she came to me because she was having palpitations for a while. And she had seen her regular doctor and the cardiologist, and they had done testing and started her on medications, which we call beta blockers, which slows down the heart. And it was working, but it had its side effects, and she didn't like those side effects. It was causing her to be fatigued and decreased libido, which she tried to tell her doctor, but there wasn't another option other than those medications to control her heartbeat. So when she came to me, I did the testing, and I found that she had a lot of inflammation, and I started treating her with high-dose intravenous vitamin C. And again, within a very short time, within 3-4 weeks, her symptoms were much better, almost resolved, and I had the ability to take her off the beta blocker, which she was very appreciative about because she didn't like the side effects. So these are the kind of things that, these are the things that functional medicine helps us do. So it helps us get to the root and replace things and heal things. So just to recap one more time. So we need to look at the root cause of the diseases. We need to repair and heal the gut. And we need to replete the nutrients, the missing nutrients. When we do all these three things, which I do in my practice and have done it over and over again, the results are remarkable. Patients' diseases are reversed. They can get off medications. They can live life without medications, without pain, without fatigue, and know that their disease is reversed, just like my doctor did for me. All right. So as a gift for you being here with me this evening, I would like to offer you a resource document. It's something that I've created, and it's actually a list of the most common medical diseases that I see in my practice and the most common root causes for those problems. So it's a reference guide, it's a resource for you. If you're interested in it, I'm happy to share the document with you so you can have it in your back pocket for whatever, whenever you need it. And if you're interested in it, you can put it in the chat and we can get that out to you. And also, some of you may be ready to, hearing this talk, you may be ready to go on and explore functional medicine for yourself. Maybe you're tired of the traditional medicine merry-go-round and you want to find out the root cause of your medical problems. And I'm happy to do free phone consult with you. I have some slots open for this week. Again, if you're interested in having those appointments to talk about how functional medicine can get you started on your journey towards health and healing, you can, again, put it in the chat and I'm happy to share some open slots that I have with you. And again, thank you very much for being here with me. It was a pleasure speaking to you today. And I hope it was useful, and I hope you health and feeling the vibrant life that each and every one of us should have, and which I enjoy now. And I wish the same for you. And thank you for being here. Thank you for listening to me. It was a pleasure and an honor. And have a great evening, and God bless you.